loved one wear dentures, I have great news for you. You can throw them away. That's just part of what they do at Freedom Mini Dental Implants. With me once again is Dr. Regan Ackerman. She has just returned from spring break. You know, I'm getting all these spring break stories from my friends, so go ahead, make me jealous. Tell me about your spring break. Where'd you go, and what'd you and the kiddos do?
So we were in Tucson, Arizona, 80 and sunny every day, and we were at a dude ranch. We love horses.
Oh, very cool. So dude ranch.
Yeah.
So do you actually like corral cattle and all that? What do you do?
They do some cattle sorting, some team penning, they call it, and ride, you know, through the Segura National Forest. It's beautiful out there. Absolutely beautiful.
This sounds fantastic, but the only thing I'm a little apprehensive about is the roughing it aspect. Do you really rough it, or do they spoil you?
No, you're still in like a hotel room. No, it's not roughing it. So
and the kids loved it.
Yes, kids love it. We ride, swim, archery, rock climbing. They have a little bit of everything for everybody.
Cool.
So,
and you seem like you enjoyed it as well. You and your husband loved it.
Outdoors, and we love it. Yes.
I love hearing that.
We love to be active.
All right, so more good news coming your way. As I said, if you have a denture wearer in your family, then you know they're probably tired of the glue, ill-fitting dentures. They can't eat the foods they love. So let's talk about how we can take care of that. I love this show for this reason. If you do not know about a product and something that'll save you money, that is less invasive, that works really, really well, maybe you've been told you're not a candidate, this is the answer. Everything is good.
Yes, yes. I actually just saw a patient this morning, came in for a consult, and I always ask, you know, how did you find out about me? And he was like, you know, I saw your advertisements. He had had all his teeth removed about 8 months ago, struggling with dentures. All of you who have dentures or have a loved one with dentures know the struggle. Constantly using glue to try to keep your dentures in, especially that lower denture. It's always wobbling, you get no suction. So with mini dental implants, we're able to, sometimes we can even use your existing denture, and then you can snap the denture onto the implants, so no more glue, you can eat better, or we can get rid of the denture completely, and I know we'll show those models later. But the mini dental implant is just a lot less invasive way of doing dental implants. I don't have to have as much bone, I don't have to do sinus lifts, so minimally invasive and usually a lot less costly than the big surgical implants.
Yeah, and when you say surgical implants, let's make it clear, when you say less invasive, we're just talking about really a little numbing, a needle of numbing, like if you were at the dentist office. That's it. I mean, just a little numbing.
Anesthetic, no sedation, no incisions, no stitches, no bleeding. You know, I show all my patients their implants, you know, after we put them in, and some of them are a little hesitant. They're like, I don't know if I want to see it. I was like, I promise you're not bleeding, you're not swollen. And they look at them like, oh, wow, that's amazing, because it really is. It's no bleeding. And because it is so minimally invasive, a lot of people that thought they weren't candidates for implants can be candidates for mini implants. And, you know, I don't have to take you off a blood thinner. Some people thought they didn't have enough bone. They were told they had periodontal disease. They can still be a candidate for the mini dental implant.
Yeah, the old method, now you may have needed more bone, and the old method was going to be invasive. But if you haven't heard about mini dental implants and Freedom Mini Dental Implants, then the news is so good, because now you suddenly, maybe something that you wanted to address years ago, you can do it now.
Correct.
And it's less costly. There's really no downside. And I did research this. When Dr. Stroud would come on, and now that you are coming on, I'd go, okay, let me check into this. There's got to be something.
Yes.
There's no downside.
Yeah, it really is a lot less invasive, a lot simpler,
less costly,
less healing time than the big surgical implants. And just being able to help people. And I mean, I don't wish dentures upon my worst enemy. I mean, they're awful to have to wear and use the glue, and being able to go out to a restaurant and pick whatever you want off the menu and eat again, and not having to worry about excusing yourself and going to reapply your denture glue. Those are all things that we do and help people.
Yes, indeed, and do it very well.
Yes.
Okay, so I'm curious, do you have before and after pictures for me today?
Yes.
Because I love this, because it's one thing to talk about it. It's another thing to see someone who is genuinely happy and thrilled about getting rid of their dentures and looking forward to enjoying the whole menu.
Yes,
right? Okay, so who are we going to look at today?
It should be Chris.
Okay,
we should have Chris, yes. So Chris came to me, as you can see, missing some teeth. You know, teeth were just failing on him. And one thing important I always like to say is, you know, people do everything they can. They go to the dentist every 6 months, you know, and, you know, genetics or whatever reason, your teeth can fail on you. So we always say we're kind of like Planet Fitness. We're a judgment-free zone, because a lot of people come in, you know, ashamed and things like that. There's no reason to be ashamed. So Chris came in, and yep, there we go. So then he was able to do, we did the permanent teeth for him, which I know we'll show models later. So he got rid of dentures completely. He had to have all his teeth removed. There is a healing process, so he, wore dentures temporarily. You're never not without teeth. But then we were able to do the permanent bridges for him with the porcelain teeth. And so, I mean, huge difference, right?
Oh my gosh, that's a handsome individual right there.
Yeah.
And I love hearing about their reaction, because they look in the mirror and maybe they've dreamed of having a perfect smile, and his look does. It looks absolutely perfect.
Yes.
So what was the reaction from Chris when he saw your finished work?
It's actually a great story. He has daughters, and he came back and he said, my daughters can just tell the difference in my personality. I'm happier. I guess, you don't realize how much you're trying to hide your smile or hide your personality because you don't want to smile or laugh. And he's like, this has been life-changing. Not only because he can eat everything he wants to eat, but just the smile and the personality. And his daughter said he could, just see the biggest difference.
Yeah, you and I have talked about, we've probably all known someone who, during conversation, covers their mouth, or they decide, I'm going to step out of this wedding picture.
Exactly.
Or, these memories that they should be a part of. And as you said, if you can't even be yourself, you're not really enjoying life. So it's bigger than just a pretty smile.
It really is.
It's about bringing out what you should be.
Yep. Or they don't go to events because they're embarrassed or ashamed, and we hear it all the time, and it's disheartening, and it's so I love my job because we always have tears of joy. Patient this week, I remember, she started crying. She was so happy, and I was like, you're gonna make me cry, but she was just so grateful, being able to not have a denture anymore, eat what she wants to eat, and smile. And same thing, she can smile and not hide her personality because she's, didn't want to show her teeth or her smile before.
If you have a question, 571-5263. If you're saying, am I a candidate, or I have a specific medical issue, call us. Dr. Regan Ackerman will handle those calls. Okay, let's talk a little bit about this. We've talked about, less costly, less invasive, all these good things. How long is the process? How long would someone have to wait? Let's say they've been wearing dentures their entire life, and they're saying, okay, is this going to be a long time before I can get my new teeth?
Certainly. So everyone's situation is different, but what you're referring to, if they've already been wearing dentures and have healed up for that 4 months, a lot of times too, if you like the way those dentures look and aesthetically they're good, we can use those dentures and save you even more money. And then, sometimes within 3 to 4 weeks, we can, have you on the schedule, and you leave for the snap-in denture, the day we put the implants in, you leave with that denture snapped in. There's not another 3 to 4 months of healing like the other implants. So if you're already healed up and you have dentures we can use, within a couple weeks, you could leave with the denture snapped in.
And honestly, call now, 571-5263, because if you've been told in the past you're not a candidate, not enough bone, maybe, as I mentioned, you have a medical issue, talk to Dr. Regan Ackerman. Things have changed. We compare it a lot to if you have appendicitis. So it is true. Back in the day, they had to cut you open, you had to heal, all this surgery, you had a scar, all that. This is now like
minimally invasive.
Yeah, like when now they use a little laser and that's it.
Yes.
Right? It's similar to
laparoscopic version of
Thank you very much. That's the word I was looking for. Laparoscopic.
Yes. So and we should also mention the consult is no charge. So when you call to make the appointment for the consult, it is no charge for the consultation. We'll take a 3D X-ray just to confirm you have enough bone. It's pretty rare that I have to tell somebody they don't have enough bone. I'd say 90-95% of people that come for the consultations have enough bone for the implants, but it's no charge for the consultation. So please, call, make the appointment, see if it's something, that would work for you and get you in a better situation.
Yep. And if you have any questions, once again, we love fielding these calls. 571-5263. Coming up in the next segment, we're going to take a look at some models. They do a couple of different versions, a couple of different procedures. You can find out which one that you prefer. And also, if you don't wear dentures, but perhaps you have a tooth, maybe a bridge, and you say, you know what, I've been putting this off. I don't like wearing this flipper, whatever the case may be. They can help you at Freedom Mini Dental Implants. We'll be right back, expecting your calls. 571-5263.
Enjoying the sunshine and fresh air can be hard for many of us. Advanced ENT and Allergy is the regional leader in upper airway care. From allergies, sinus problems, sleep apnea, hearing health, and more, our medical team treats everyone like family. Advanced ENT and Allergy offers same-day appointments, and for many, no referral is needed. Our outstanding team of physicians, along with state-of-the-art technology, can get you breathing right, sleeping well, and feeling better sooner. Go to advancedentandallergy.com for your appointment. 8 locations.
Of course the AC dies in the middle of summer. Luckily, we're members of American Home Shield.
American Home Shield provides home service plans that help cover the costs when parts of more than 20 home systems and appliances wear out, like our AC just did. And if they can't repair it, they'll replace it.
This is totally fine. I don't have to worry about finding someone to fix my fridge. I can just stick to making breakfast. American Home Shield has flexible plans to fit your budget and needs.
Fizzled toilet's been flushing for 3 hours straight. It's no biggie, though. My American Home Shield plan covers items no matter their age. I already showered today. For a free quote, go to ahs.com. That's ahs.com. You stay.
Sometimes a little distracted is too distracted.
Uh-oh. What happened? A little distracted.
Dude, my shoe!
If you or a loved one have been affected by a distracted driver, visit SueDistractedDriver.com.
We talk about all the advantages of Freedom Mini Dental Implants, and one of the big ones is everyone's on a budget, right? We all agree with that. So let's talk about a lot of our questions that are coming in are concerning cost.
Sure.
The old method, the surgical method, it is a lot less costly than that one, right?
Correct.
That's for sure.
Yes.
But as far as everyone's a little different.
Right. Every procedure is different. So when you come in for the consultation, of course, we'll go over treatment plan and cost. But overall, we can say, we see a lot of treatment plans. People come in with the surgical method, and I would say the mini implant is usually about a third. Sometimes it can be even half the cost of the surgical implants. And we do offer financing plans, so that's something we can always help you with too. We have 3 different financing plans and companies we work with. A lot of times, if you qualify, there are some no interest options. So there's multiple ways as far as the financing goes to make this work.
Wow, a third up to 50% less.
Yes.
So that's significant savings. And again, the consultation is free, so there's no risk. Go in and check it out and find out exactly what it's going to cost you. Believe me, you'll love your smile as Chris did, and we'll show his pictures up again in a second. But first, let's grab some phone calls. Ask and ye shall receive. Etta joins us now. Etta, welcome in. Thank you for watching.
Thank you for having me on. I've had dentures for probably 20 years, but once I got them, the bottoms never fit right. I'm on my 3rd pair, but gums and jaws have receded from not having, I guess, bone loss or something, and I look so much older than I am. I can't eat the foods that I once loved because I only have the top teeth. And I'm just curious, would the implants be able to correct that bone loss and give me back, my smile that I once loved and be able to eat better and things like that?
Yes, Etta. So great question. I see lots of people in your situation. And yes, I have a lot of people that come in and they'll just do what we call the lower denture stabilization or a lower snap-in denture, because it's that lower one that everybody complains about the most. You are not the only one that has kind of given up on your lower denture because it just flops and it moves. And especially after having dentures for so long, yes, the bone has probably resorbed some and you don't have as much bone. But that's the nice thing about the mini implants is that I'm able to still be able to put mini implants in because the reason we call them a mini implant is it's just a small diameter implant. So a lot of times, even if you don't have a lot of bone, and like you said, the bone and gums have receded, you could still be a candidate for the mini implant. So I would definitely advise calling and setting up a consultation, and we'll take the 3D x-ray and I'll be able to confirm and check that you have enough bone to place the implants, and then we can maybe convert that lower denture and make it a snap-in denture where it stays in and you can eat with it again.
And to be clear, it's very seldom that you say no. It doesn't take a lot of bone because of this procedure.
Correct.
In fact, this is probably a good time to show your jawbone here. We have great cameras here at Wave, thank goodness. And if they can pick it up, watch how small the hole you need. Now, first of all, the big hole is what? What is that exactly, doctor?
So the bigger hole, that's much easier to see. That's more the surgical, bigger implant.
They need more bone.
Yeah, so they make an incision, usually place the implant. A lot of times it has to heal up another 3 to 4 months. Versus versus this little tiny hole, like you said, that is kind of hard to see. That is the little hole that I make to place an implant. So I don't have to have as much bone. I don't have to do bone grafting or sinus lifts. I don't make an incision. I make this little pilot hole, you know, through the gum into the bone, and then place the implant, which is a titanium screw that just kind of screws and torques down into the bone. So a lot less invasive. And then, like I said, it doesn't have to heal up another 3 to 4 months. If we're doing a snap-in denture, the same day I put the implant in, you'll leave with the denture snapped on to those implants.
All right. Yeah, and again, 2 procedures. There's what Chris had done, which is the permanent teeth, no plastic whatsoever, or the snap-in dentures. The choice is yours. We go back to the phones, and we're going to welcome Doug to the show. Doug, thank you for calling. You have a question for Dr. Ackerman.
Yes, I do.
Hi, Doug.
Okay. First thing is, I'm terrified about going to, I guess, well, maybe she's not a dentist or whatever the case may be. But my thing is, I'm terrified about getting some work done. I have some teeth that really need to be dealt with. But I guess my question is, I guess my question is, how painful will it be if I had maybe like several teeth replaced?
At one time, yeah. And just to kind of maybe answer to one of your questions, because it sounds like you may need some teeth extracted or removed, and we refer that still to an oral surgeon, and the oral surgeon can do sedation or put you to sleep for that. And when we place the implants, though, it's so minimally invasive that we don't do sedation. You know, not to say you're going to have a little discomfort the first, you know, what I say 24, 48 hours, but we always prescribe antibiotic and pain medication, but I have a lot of patients that don't even use the pain medication. But usually that first day, so if we're doing multiple teeth, say we're doing 4, 5, 6 teeth at one time, you know, that first night you're going to have a little discomfort and some achiness. You've got your pain medication to take. A lot of people just do 800 milligrams of ibuprofen. So not nearly as painful as the surgical method, though, because I'm not doing incisions or stitches or anything like that.
And thank you for the call, Doug. Yeah. Again, the consultation is absolutely free, so please visit the office. Okay, let's try to squeeze in another call. Paulette joins us now. Paulette, welcome in. Hello, Paulette. Hello, hello.
Pauline?
Is it Pauline? I apologize.
Yes, Pauline.
Hi, Pauline.
Hi.
You have a question?
Yes. I wanted to know, number one, I am allergic to plastics. I can't drink with straws and everything. Now, are these implants plastic? Or can you use my dentures on the bottom to put in my mouth? I'm not quite sure that this is possible for me.
Yeah, so the implant themselves, there's no plastic. It's a titanium, so it's like 99.9% titanium. So the implant itself is not plastic. And if you're currently already in a denture, then, you know, as long as that denture, like I said, I would check it and make sure we could use it, but we could use that denture and just place the implants and then, you know, snap the denture on. Or, you know, when you come in for the consultation, there's other options to get rid of the denture with porcelain teeth, you know, things that aren't plastic that probably you could even get rid of the denture if that's an option. But the implants themselves are titanium, so no plastic.
Yes. Pauline, thank you very much for the call. Appreciate that. And if you'd like to call, 571-5263. Coming up, we're going to show the 2 methods. And I recommend to you, Pauline, do the porcelain teeth. No plastic whatsoever. We'll show you those models next with Dr. Regan Ackerman. That's a good question.
Hi, I'm Tim Jones back for Toyota of Louisville. New vehicles on the way. Be sure to reserve yours today. Pre-owned vehicles, good selection, and we offer second chance finance. Remember, we want your trade. Toyota of Louisville is Swope dealership where nobody walks away.
Is your concrete cracked beyond repair? I'm Steve with S&S Concrete, and we can fix that. We do almost any type of concrete work, many jobs completed in just one day. Call now for $1,000 off, and financing is available. Call S&S Concrete today.
Free is our favorite word, like buy one, get one free.
2 treadmills.
At Morgan & Morgan, our fee is free. You don't pay anything unless we win your case. Injured? Call Morgan & Morgan. ForThePeople.com.
Let's go! Since my mother got cancer from smoking, I've learned a lot of things, like how to help her out of bed, how to keep track of her medication, and how to keep her spirits up.
The people you love are worth quitting for. You can quit. For free help, call 1-800-QUIT-NOW.
Most bladder leak pads were similar, until Always Discreet invented a pad that protects differently, with 2 rapid dry layers. For strong protection that's always discreet. Question your protection. Try Always Discreet.
Oh, man, that's a whole lot of wrinkly. At least my shoes look good.
Help prevent wrinkles with Bounce Wrinkle Guard, the mega sheet with 3 times the wrinkle-fighting ingredients.
Find that perfect gift for any occasion at Little Mount Lavender in Simpsonville. We use our local farm-grown lavender in over 1,000 products. Plus, you'll find unique gifts from other local artisans. Treat yourself and family and friends well today at Little Mount Lavender.
Hi, I'm Tim Jones, back for Toyota of Louisville. We're back in the service department. Oil change, tire rotation, quick job, or big job, we can do it right the first time. Call and make an appointment, or just drop by Toyota of Louisville, a soap dealership where nobody walks away.
Freedom Mini Dental Implants. Okay, you're tired of all the talk. You say, look, the proof's in the pudding. Let me take a look at Chris, who is a patient and a friend now of Dr. Ackerman's. You said he is one nice guy, and he sure looks like a happy guy in that second picture.
Yes, he was very happy to get rid of the dentures. He had got the permanent teeth done. The other big advantage of getting rid of those dentures is that you can taste your food again. You have nothing on the roof of your mouth. You eat steak again, you know, peanuts, all those things that everyone misses. You can eat those again and taste your food.
Okay, before we show the model, before we do that real quickly, and we'll show you the model, what Chris decided on, and you may have a different decision. Let's go back to the phones and talk to Lee, who has been nice enough to call. Lee, welcome in.
Hello, thank you for having me.
And you have a question for the doctor?
Yes, I have 3 old bridges from 1990 and would like to update my smile. I'm only in my 50s and would really like to improve my appearance.
Yeah, so the biggest thing to determine first is to make sure those, you know, if the teeth that are anchoring those bridges, if they're not in good condition and they have cavities, if they need to be, you know, extracted or removed, then we would do implants. You know, it is always an option maybe just to have those bridges replaced by your, you know, regular general dentist. But if they need to be removed completely and those teeth extracted, then the mini implants would definitely be an option. And then we would do new, you know, crowns and bridges and update your smile, which sounds like that's your goal. So definitely the best way to know that is to come in for the consultation and see what condition those bridges are in. You know, if we can just replace the missing teeth, if teeth need to be removed, or, you know, if you don't need implants, I'm going to tell you, you don't need implants. You just need to go back to your general dentist and get those bridges kind of removed and updated.
So if you 1, 2, 3 teeth, you can do that as well. You don't need the whole set of teeth.
Yes.
No, okay.
Yep, and we can show that model if you want to start there.
Let's start there, and then I want to show you Chris's methods because it's really cool. But go ahead.
Yeah. So I know we've talked a lot about dentures and missing all your teeth, but you know, a lot of people are just missing one tooth, you know, in the front. Maybe they were born without a tooth or had trauma. And if you're wearing a flipper, you know what it is because you hate it, or a little partial that comes in and out. So we can replace a single tooth with the mini implant. Same thing, no incisions, no stitches, place the implant. You don't have to wait like another 6 months to get your tooth. You know, we put a temporary on that day, and then a couple weeks later you come back, and then we have the nice pretty tooth, and it gets cemented on to that implant permanently. So you no longer have anything coming in and out. And not only do we just do one tooth, you know, a lot of people are missing, you know, your molars in the back, and they want something to chew with again. So we can do multiple teeth. This is showing 3 teeth. Same thing, we're going to place the implants, and then we get that bridge of teeth made, and then these will cement on permanently onto those implants. You know, I had one patient that said it was like growing their teeth back when we, you know, placed those on. Magically grew her teeth back. But it's just a really nice way to replace a partial if you have one, or if you know, are just missing teeth and you want to be able to chew better again, this is a great way to do it.
Yeah, just water pick and chew just like your regular teeth, right?
Yep.
Now, Chris's method, which I think is, to me, I love this because there's no plastic whatsoever. It is truly like having another set of teeth.
Yes. Yep, it's like your 3rd set of teeth. So yeah, they get cemented on. They don't come in and out anymore. You brush them just like normal teeth. Get them cleaned every 6 months, just like your regular teeth. And you're able to smile like Chris there and chew and bite into that hamburger and that pizza. And, you know, one thing that, you know, we talk about steak a lot, but I have a lot of people say that they miss eating salads. They have a hard time chewing and eating salads with, you know, loose dentures. So this, with the mini implants, definitely stabilizes things and can get you eating healthy again.
Yeah. You miss that nutrition and the crunch.
Yeah.
So Chris's method, show them how this works. This is really cool.
Yeah. So placing the implants the same way.
This is just your gums, right?
Right. So imagine this is your mouth without teeth. This whole thing doesn't go in your mouth. People do ask that, so we will clarify that. But no, I'll just numb you up, local anesthetic, so I'm not doing sedation or putting you to sleep. No incisions, no stitches. Make that little pilot hole, just like we had showed before, and then this is just a little titanium screw that kind of screws and torques into the bone. You know, we'll place as many implants as the size of your mouth and bone allow. And then once we have these implants placed, then we're able to make this bridge of teeth.
And that's it.
And that's it. You can see nothing on the roof of your mouth, no big bulky denture, no plastic anymore. And the nice thing about this option is that this gets cemented on permanently. So it no longer comes in and out. It is, you know, no movement. You brush it just like you brush your normal teeth, toothbrush, toothpaste. We do give you a water pick, kind of like a power washer for your mouth to kind of flush the edge and keep everything clean. But then you really have nothing on the roof of your mouth anymore, and you get to taste your food. It doesn't affect your speech anymore because you don't have that big bulky piece of plastic on the roof of your mouth. So these are the permanent teeth. Great option to get rid of the denture completely.
So, and let's talk about the consultation again. Okay, it is absolutely free. How long does that take? What's involved with the consultation?
Yeah, so usually it's about a 30-minute appointment. You'll see me. I'm the only dentist there. That is one thing we always like to mention too, is that we're not a corporate office. I own the office. My husband works with me. We're a small, locally owned office. So you will see me. You know, I'll look at the 3D X-ray we take. I'll do a quick exam, and then we'll go over all your options. And then we'll certainly go over cost and explain the financing plans if that's something that you need to look at. So the consultation typically takes about 30 minutes, but you will see me, and we'll go over all your options, answer any questions you have, show you the models, and go over costs.
With limited time here, can you show me the snap-in real quick? We got about a minute.
Yeah, we haven't even shown this yet. So yeah, real quick, this is probably one of the most common things we do. Place the implants.
Fewer implants.
And then this is the denture. So the same day I place the implants, I'm able to put these attachments inside your denture, and then your denture
secure
snaps onto those implants. So no more floppy denture, no more denture glue, and you'll just take it out once a day, rinse and clean it, and snap it right back in. And no more denture glue.
There we go. Freedom Mini Dental Implant. She is Dr. Regan Ackerman. Make your appointment today. The consultation is free, and have the smile of your dreams just like Chris. There's all the information. All right, we shall return and then put a bow on the show. We are Wave Listens, and it is the Wednesday edition.